What's the best drink for diabetics to start their day? In this video, I'm going to tell you about 5 options that won't raise your blood sugar and also offer several health benefits. So, these are good drinks. There are a few contraindications, and I'll break that down in this video. Also, I will cover how to prepare these drinks, what's the correct dose. Let's talk about this. I am an endocrinologist specializing in diabetes, and I'll discuss this topic, which is a common question among you and also recurring. There are 5. I will begin in decreasing order. So number 5, a fantastic drink for those with diabetes who want to look after their health is lemon juice or water with lemon. Here, I'm not referring to box juice that has lemon flavoring, as that can have added sugar, but I am referring to homemade juice. It's quite simple to make. It's really easy, just to avoid confusion. Why don't lemon water raise your blood sugar? Because lemon, despite being a fruit, some people say fruits have fructose. Lemon has a very low amount. Lemon has almost no sugar, no carbohydrates. So it's an excellent fruit for people who have diabetes and are checking their blood sugar levels. Any other benefits? Besides not raising blood sugar, lemon is also rich in vitamin C and antioxidants. Citrus fruits can relax blood vessels, so they can also help with high blood pressure. It's important to point out here that these drinks I'm explaining do not cure diabetes. I'm not saying that. So be careful not to misunderstand this video, because many people say, "Oh, my doctor said drinking lemon water doesn't solve diabetes." Of course not. These drinks have the potential to assist with control, but not worsen your condition, okay? Alright? So nobody here is talking about a cure or a secret solution. Another common question is whether lemon could cause any stomach wounds, some stomach ulcer, or some intestinal illness. And the latest studies show that this is not true. So lemon is indeed safe. First, because you're not going to squeeze the lemon, you're going to take that juice and dilute it with water. That's a point in relation to acidic pH that many people worry about. All good? So that doesn't happen. Oh, but what if I already have a stomach ulcer? I have a wound that even has the risk of bleeding, the doctor said. Well, in that case, before you consume any acidic substance like lemon juice, you'll firstly consult with doctor, because in that case there may be a contraindication. No, if you're symptomless, take tests, and everything is okay, you're not going to create any problem because of the lemon. Understood? That's why there's so much confusion on this subject. For those who find lemon juice too sour or acidic, there are 2 solutions. Firstly, add a little less juice. This will dilute your juice more, and it will taste less sour and less acidic. Second option is to add an alternative sweetener such as stevia, xylitol, or erythritol. Just remember not to put sugar in the lemon juice, as this will increase your blood sugar level, which isn't good for people with diabetes. Number 4 drink is also great for those who have diabetes. I'm a big fan of this one. I have it every day. It's black coffee. Why black coffee? Because there are several ways you can consume coffee. There are various blends, frappuccino or cappuccino, capsule coffee with added sugar. I'm talking about black coffee here, and it can be 3 to 4 cups of 200 milliliter filtered coffee or 3 to 4 shots of espresso. The shot of espresso can vary from 30 milliliters to 50 milliliters. One serving of espresso coffee has the same amount of caffeine as a 200 milliliter cup of brewed coffee. Each serving typically has 100 milligrams of caffeine. To enjoy the benefits, you can safely drink up to 4 cups of coffee a day. Most studies suggest 3 to 4 cups is the recommended amount. Why is coffee so good for our health? Coffee has lots of substances like chlorogenic acid, flavonoids, and tocopherol, which is vitamin E. These antioxidants fight free radicals, and there was a study that found that people who drank up to 4 cups of coffee per day were 33% less likely to develop type 2 diabetes. It's not exactly clear why this occurred, what substance caused it, or if there were multiple substances involved. Caffeine itself also has various studies supporting its health benefits. But I can't drink coffee because for me it triggers anxiety or else I don't sleep properly. Some people report the side effects of coffee, usually due to its caffeine content. It can definitely disrupt sleep, and if you are sensitive, it can trigger an anxiety attack. But for most people, coffee won't cause problems if consumed in moderation. Regarding coffee and arrhythmia, there was a study that found that if you drink a lot of coffee, which constitutes a lot, more than 8 cups per day, it could have an effect that promotes arrhythmia. You could increase your chances of having a heart arrhythmia. So of course, everything in excess is going to be harmful, but 3-4 cups a day is beneficial for your health. If you're diabetic, then another plus, it won't raise your blood sugar. The same thing I said about lemon juice, it's not worth adding sugar to the coffee. If you sweeten your coffee, remove it slowly, little by little. 1 week you put half the sugar, then a quarter, then you try to remove it completely. If you can't, then replace it with an unnatural sweetener. It will be good for your health. It's very interesting that those who make this gradual withdrawal, as was my case, happened to me. I used to drink coffee with sugar. After a while, you can no longer drink coffee with sugar or sweetened. That's very curious because you can get used to the taste of coffee and then you can't drink it anymore. If this was your case, write in the comments. He also gave a suggestion for people who are trying to stop putting sugar in their coffee. Another interesting tip, I learned this from a patient who said that he was only able to remove the sugar from his coffee when he changed the brand. He started buying coffee from a different brand, and I've recommended it to other people. If you really can't do it at all, try drinking coffee from a different brand, and it also worked. So here's the tip for you. If you've tried everything and still haven't been able to get the sugar out of your coffee, try changing the brand of coffee you buy because it will help you in this process too. The third drink is water with chia seeds. 300 milliliters of water and 2 tablespoons of chia seeds. No other mixing, no adding yogurt or anything like that. It's water with chia seeds. That's right. Why? Because chia has calcium and chia has magnesium. Studies have shown that foods rich in magnesium can improve the issue of insulin resistance. Chia also has good fats and can help reduce your cholesterol as well as increase good cholesterol, which is beneficial for diabetic health. Fiber has been proven to help regulate your gut, lowering your risk of bowel cancer. Chia also makes you feel more satiated. You're going to eat less, you're going to be able to control your weight in a better way, which is beneficial for diabetes and blood sugar. And chia is also low in carbohydrates, meaning it won't raise your blood sugar. So chia is an excellent option for diabetics to start their day. I really like it. And there's something else too. Chia seed water is very practical and quick to make. You don't need a whole schedule to consume it, and it has the benefits I mentioned. So it's a great option for people with diabetes and for those who don't, but who are taking care of their health. I use chia in my food. Sometimes I use chia, sometimes flaxseed. I don't know what your preference is. What fiber do you use? Since I'm talking about fiber, some people say that oats are a good fiber for people with diabetes. Oats, though, are more than half carbohydrates. So oatmeal isn't a good food for those with diabetes. There are better options out there with better fibers like chia and flaxseed. You'll be making a wiser choice. Oh, but is oatmeal better than flour? Well, that's a different story. I'm comparing oats to chia and flaxseed, and in that case, oats can't compete. So it's not an ideal choice, it's not the best choice for those with diabetes. But it's still far better than white flour. Got it? Do you understand? About chia and oatmeal? The second drink that won't spike your blood sugar in the morning is apple cider vinegar. And here I'm not talking about drinking pure apple cider vinegar like some people recommend. You need to dilute it with 300 milliliters of water and a tablespoon of apple cider vinegar. There are several studies that talk about the health benefits of apple cider vinegar, like reducing triglycerides. Did you know that? As a diabetic, you also need to take care of your triglycerides, and apple cider vinegar can help with that. But there are also studies about the benefits of acetic acid for our health. Oh, but doesn't apple cider vinegar cure diabetes? No, of course not. The same goes for what I said about lemons. There are a lot of myths about it. But this video is about drinks that don't raise your blood sugar. Apple cider vinegar is an option if you like it. Personally, I can't drink it, despite the health benefits. Have you tried it? Do you like it? I have 3 of the 4 drinks I talked about. Apple cider vinegar is the one I can't drink, and the number one drink, the one that's been studied a lot with many scientific studies, is green tea. I particularly like green tea. It's rich in antioxidants that fight free radicals, which means it's excellent for your health. It also has catechins, which are substances that have also been studied for their potential health benefits. You just have to remember that green tea has caffeine. That's right, it's not only coffee that has caffeine. Green tea also has caffeine. So if you're going to drink coffee, you've already had your fix of coffee, so you shouldn't drink green tea. If you've already had your fix of green tea, don't drink coffee, because we've already seen that too much caffeine can be bad for your health, but green tea is indeed a low-carb option and people with diabetes can benefit from it.